So in my practice, once we remove the implant and perform a capsulectomy for a patient who wants a total capsulectomy with their implant removal, then we start thinking about restoring the breast to its original shape. What you may not be aware of and what many plastic surgeons don't talk about, and there isn't a ton in the literature, is the fact that after breast augmentation, your breast shape will change. So typically what I see is that the breast has become wider and lower. In addition, there is sagging of the breast tissue over the implant. To restore your breast shape to its original shape, we need to make it narrower, we need to elevate the breast position on the chest, and we need to do a breast lift. And this is far more important in terms of your final result than the breast implant and capsulectomy procedures, because this is what determines your final shape. For the past 18 years, I've been operating on patients who have had massive weight loss, as a result of which the whole breast unit can drop lower on the chest, it can become wider, there is deflation and significant sagging. And I have created procedures that not only restores the breast shape, but also places it higher on the patient's chest. And these procedures can offer a comprehensive approach to breast reshaping, breast restoration, and breast refinement after implant removal. If you have had large implants, what will happen is that during implant placement, your mammary crease, which is the crease or the fold that you naturally have under your breast, would have been lowered so that a larger implant can be accommodated. Also, with larger implants, usually you have breast tissue that now migrates on the outer chest. Many times, when the implant is removed, the whole breast unit has been lowered, and that breast unit can be restored to the middle of the chest through a breast repositioning surgery with inframammary fold reconstruction at a higher level. As you do that, essentially you take this mammary crease and bring it higher, you get a reverse tummy tuck effect. So even though the procedure is not a reverse tummy tuck, it gives you a reverse tummy tuck effect by lifting the upper abdominal skin higher. So we are taking the breasts that are low on the chest and putting them higher. Also, when patients have widening of their breasts as a result of the implant, then that can also be narrowed at the time of a breast lift and repositioning. And that procedure is called a J-thoracoplasty, which can be done at the time of a breast lift. So the breast can be placed higher through inframammary crease reconstruction at a higher place, and the outer chest tissue can be migrated forward so the breast becomes narrower. Obviously, these two procedures have to be done in the context of a breast lift, and my favorite breast lift procedure is a dermal bra suspension breast lift that Dr. Rubin and I pioneered in 2005. That is a comprehensive breast lift that can be utilized to control not only breast shape, but also breast width, breast height, and I can also create cleavage with it at the same time. The other reason that I am very fond of the dermal bra suspension breast lift is the fact that I can create projection with it. Most breast lift procedures are virtually two-dimensional and they cannot enhance your projection, meaning that if you're here, you'll still be here, but higher. With the dermal bra suspension, I typically create projection, meaning I take your breast tissue and bring it together so much that it actually starts projecting out of your chest, just like an implant. And if you go and look at our Instagram results, you'll see that the results of the dermal bra suspension breast lift on the operating room table is just like an implant. But what we've done is we've taken all of your breast tissue, the adjacent breast tissue as well, the outer chest breast tissue as well, and brought it together and created a breast mound and have placed that mound at a higher position on the chest. And when you do all these procedures together in tandem, obviously you will get a much better result, because the procedures now offer breast repositioning, breast narrowing, breast lift, creation of breast projection, and utilizing all of your breast tissue to create a new breast for yourself. So with that said, all of these techniques can work well when you have a moderate amount of breast tissue or a large amount of breast tissue to start with. What happens if you don't? What happens if you are more of an A-cup breast? For those patients, typically I can borrow tissue from the adjacent areas to bring autologous tissue to the breasts. We can use your upper abdominal excess tissue, if you have an upper abdominal roll here, to augment your breasts with that, essentially recruiting upper abdominal fat into the breasts. We can use your outer chest excess fat and migrate that forward and recruit that into your breasts. We can use your mid-back fat and spiral it forward and place that into the breasts. And we can do all of those at the time of a breast lift and reshaping using the dermal bra suspension technique. So if you do not have a lot of breast tissue, but you do have tissues adjacent to your breast, whether it's upper abdomen, outer chest, or back, and you want those areas also enhanced, we can utilize those tissues to create autologous, which means from self to self augmentation of your breasts at the time of the reshaping. And if you don't have any of those, our final option would be fat transfer to your breasts. And that means we have to find an area of unwanted fat on your body and then liposuction that fat and transfer that fat into your breasts. Now, that can be done with any of these options. You can have your breast reshaping and restoration, or you can have your breast reshaping and restoration and use adjacent tissues to augment your breasts, or you can do that and at a later stage come back and have additional fat transfer to your breasts. So in my practice, I offer a very comprehensive approach to breast restoration, rejuvenation, and reshaping, whether we are just removing implants, whether we are removing implants with a capsulectomy, or whether you require breast reconstruction surgery for other reasons.